So thank you all for having me. I am a licensed clinical social worker. I am also a mom of two kids with food allergies as well, so similar to Jody, and I'm an adult living with food allergies. So I kind of took my personal experiences in life and my professional experiences as a clinical therapist and started my practice about 6 years ago, and I just have never looked back. Shout out to a few of the members that I have known for a while of your group already, so I appreciate being invited here. I'm sure each of you already have some background on, hey, I've definitely seen this in my practice. I've definitely seen patients with, food allergy anxiety. So today I really just want to, quickly go through it, make sure there's a general basic understanding of how it can be different from general anxiety, and then give some really, I guess, basic, what can we do in the moment in our clinics, and or how do we refer out appropriately? So, like I said, identifying, treating food allergy anxiety, really, I find that as clinicians, you guys are the first stop, and people will often, as trusting clients or patients, come to you and be more open with you sometimes than other clinicians or other practitioners. So I do love to work with the nurses. I am, by the way, a allied health member of Quad AI and the college. I was at the college annual meeting. I will be at Quad AI as well. I would love to connect with any of you, all of you. So feel free to, shout out to me. Hopefully I'll get to meet some of you in person. So food allergy anxiety, little different than general anxiety in that it's specifically linked to being worried about having allergic reaction. Is there food, cross-contamination or cross-contact anxiety about it that's really negatively impacting their functioning? And, it's hard to say to somebody, oh, don't be worried about it, it's totally fine, when it's different than, oh, I'm scared of a spider, right? So food allergy anxiety is something that we have to navigate of when is it a safety mechanism versus when is it affecting our daily functioning as a food allergic parent or child or patient, adult patient. So what I'm sure, again, each of you have seen probably in your own clinic, there's multiple studies at this point that show how food allergies can really affect quality of life, not just for the patient who has the diagnosed food allergy, but also the caregivers, family members, and social interactions in general. So with food allergy anxiety, it can be a little tricky because sometimes those physical symptoms mimic or can mimic the physical symptoms of anaphylaxis. So oftentimes we look for some other symptoms to help us diagnose or identify, hey, could this be an issue? One of the things that I find the easiest way to screen when you're in the middle of a quick appointment is just to ask simple questions. Do you feel like your food allergies prevent you from doing things that you want to do? Do they prevent you from going to certain restaurants or traveling or going, to friends' parties? Is it feeling overwhelming to go food shopping? Basic questions can really make a world of impact on the data or information you get back pretty quickly. And I always like to focus on not just the patient, but the caregiver. I don't know how many of you are in pediatrics versus adult allergy or in the healthcare field in general, but I see it all. So I see kids from 9 and up because that's when they really start to understand the gravity of the diagnosis and what it means for them often. I see moms, parents, caregivers, typically moms of, infants, toddlers, preschool age kids, because they're terrified to let their kids do anything. And then I've really started to see a bigger increase in young adults either entering college for the first time because they don't have the skills that are needed to empower them to live safely and inclusively, or I'm seeing more young adults entering the workforce and they're trying to navigate, how do they have a social life? How do they, connect with people in the workforce without having to spill their entire medical history at the dinner table? So looking at, again, we kind of already, I mentioned this already. We know that it definitely impacts quality of life, not just for the diagnosed patient, but caregivers, family members, parents. And it can really impact their mental health, obviously more than just the anxiety piece, but the overall functioning and mental health and isolation and depression, and really how they interact and the lens that they use to interact with the world. It can be really challenging when it's off the charts with, the anxiety needle, I guess you can say. This diagram I put in here because I often hear from practitioners, well, how do we know if it's food allergy anxiety or some other type of psychiatric diagnosis? So this is actually a diagram from the Clinical Review Allergy and Immunology, Clinical Reviews in Allergy and Immunology Journal. It was a review of data that really tried to give an algorithm for managing comorbidity with disorders in patients with food allergies. So it's a decision-making tree that I like to share with clinicians that, you can screen for depression, bullying, anxiety. PTSS is post-traumatic stress symptoms. So it's not necessarily a quote unquote diagnosed PTSD, post-traumatic stress disorder, but they might report having symptoms of post-traumatic stress. So when we're looking, at depression, anxiety, we can ask questions, something as simple as like, well, what is it that you're stressed about in relation to not going out to eat? And it might be like, well, I'm afraid to talk to the waiter. Okay, that might not necessarily be food allergy anxiety. It could be a little light bulb for maybe I need to ask further about their social interactions. Is this social anxiety? And again, not necessarily for you to diagnose, but to determine where's my referral source going. Am I referring to a PCP? Am I going to refer to a specific behavioral health clinician? Or do I feel like I have the resources to kind of give general tools for their toolkit in navigating? By the way, feel free to jump in at any time if you guys have any questions. I'm pretty informal, so I appreciate and welcome conversations and questions. So one of the things that when I was putting this slide deck together, was thinking through is like, okay, so great. We know that food allergy anxiety is prevalent. We know that we have a 15-minute appointment. How do we know who to refer to? How do we know what type of treatment options are even available if I identify that a patient might benefit from some type of additional mental health support? The basic, most common form of evidence-based therapy you're going to find for food allergy anxiety is cognitive behavioral therapy. So it's looking at, our thoughts control how we feel, which control how we do. And if we can explore like, well, what are your thoughts around your food allergies? And if their thoughts, something as simple as you can ask the question, well, when you go to a friend's house, do you feel like you can sit next to your friend who's eating your allergen? And if their answer is no, you can say, well, what are you worried about? And they're like, well, if they sneeze and a piece of their food gets into my food and then I take a bite and it gets into my mouth, right? It gives you that concept of where's their thought process, that data. So again, it's looking at where's their thinking and then how do we navigate how to shift that thinking, give them coping skills to manage in the moment anxiety, and also incorporate relaxation techniques, because oftentimes when patients are trying to distinguish between, is this anxiety or is this a reaction? If they can use their coping skills to decrease their anxiety in the moment, and they're still feeling certain symptoms, it gives them more evidence for themselves to know, no, this is definitely, I need to like take action, seek medical help, use my epinephrine, and move forward from there. Another treatment option that is often helpful to explore is exposure therapy. And exposure therapy is not an oral food challenge. That is not what we're talking about. Exposure therapy is an evidence-based treatment often utilized, especially in obsessive compulsive disorder diagnoses and or obsessive compulsive like characteristics or behaviors. And the goal is to have, again, the exposure to the things that make them scared or anxious in a safe and controlled way to build their emotional tolerance, to build their ability to sit with that uncomfortableness before they feel that urge to do that obsessive, I can't talk tonight, I'm sorry, compulsive behavior, right? So again, it's the same concept. Our thoughts control how we feel, which control what we do. And if they have an anxious thought about their food allergies, they feel stressed, anxious, fight or flight. They do something to change that feeling. They do that compulsive behavior, which decreases their anxiety, and then that pattern repeats. Our goal is to break that pattern with exposure therapy. So we let them sit with that uncomfortable thought of, oh my gosh, if I get exposed, XYZ is going to happen. And we give them new evidence to say, oh, it didn't actually happen. I didn't do that compulsive behavior and it didn't actually happen. So exposure therapy can be a really helpful strategy for addressing food allergy anxiety. Again, so when you're talking to other clinicians or looking through your own resources, looking for cognitive behavioral therapy, coping skills, strategies, apps, and looking for a clinician who's versed in that, as well as exposure therapy, if possible, can be a really useful tools. I will say also, exposure therapy is something as simply proximity challenges, right? So you might do that in your clinics already to do proximity challenges, which is exposing the patient to their fears and showing them that it's okay and they can navigate it. Mindfulness, right? Everyone says, okay, just breathe. Everyone breathe. I don't know about you guys, but when I am stressed and someone tells me to breathe, I really don't like them. And I don't want to listen to them. And I'm frustrated with them. So oftentimes the way that I like to help clinicians inform their patients is first we need to deactivate their nervous system. And that doesn't always happen initially with breathing. Breathing's probably one of the fastest ways to regulate it and bring it down. But sometimes, again, we can use other tools, taking a walk, removing ourselves from the situation, getting a different environment. And then we can use something like mindfulness and relaxation techniques with breathing to lower that fight or flight response so that they can then think clearly, more clearly, to then focus and think about what they want to do differently. I really like to use technology in the apps, in the app form of things that help in the moment. There's great breathing apps that you can download. I think one's like Breathing Zone, it's even called, of it is literally like an image that tells them when to breathe in, when to breathe out. It's guided breathing that can be helpful. It can be Insight Timer is a great app as well. Calm, Headspace, those are all apps that they have free versions. They have paid versions, but I often recommend them to patients to keep on their phones because it's something that pretty much they have with them all the time. Okay, support groups and peer networks. This one is a tricky one. Whenever I have a client call me and go, I'm freaking out, I really need help, I don't know what to do, my first question is always, are you on the Facebook groups? And their answer is typically yes. And I go, good, get off. Right? Because that is often a source of stress and anxiety. And so they come in those heightened levels because they're reading and they're online and they're doing their research. And so when I am talking about support groups and peer networks, this is once they have a healthier relationship with their food allergy diagnosis. There are certain ways to use online groups to their benefit, such as, hey, if you're looking to research, a place to go on vacation that's been great with people with food, accommodating people with food allergies, you go into a certain group, you can, search your keyword Orlando, Disney comes up, everyone goes to Disney. Okay, great. Right. So they do serve a purpose, but I don't want to say never because I'm not a always or nothing, but I typically never will say, go there first. I really try to limit that and also limit what type of groups I'm referring to. I know like FAIR has great like teen groups. So it's a support group that's more vetted. It's online connections in a more regulated arena that can be super helpful. I actually, pre-COVID, there were more support groups in the allergy clinics, parent to parent. And I hope that starts to come back, because I think that face-to-face interaction can be extremely important to connect with people, boots on the ground in your community, people that have gone to the same elementary schools as your kids and have already navigated some of the challenges, people that have gone to camps in your area and have, again, already navigated maybe some of the challenges, and or protocols that have been set up. So, and it also, again, gives allergy clinics a chance to give, develop community, providing a supportive, safe environment, but also regulating a little bit about what are the resources that they're sharing. Are they valid? Are they reliable? Or is it, Dr. Google? What do we do with parents, right? So one of the things that parents often go to the internet for is they get this diagnosis and they go, great, now what do I do? What do I feed my kid? How do I do this? And so with parent training, when you think about how do we prevent this from happening, it starts with education, as most of you probably know. So we really, if we look at what type of education can we provide our parents or families or patients at the time of diagnosis, either as a follow-up appointment or, in the moment, which I would typically at the follow-up appointment, because you don't have time to go through everything. But really, and I know you guys are working on this or have been working on it, like the food allergy educator, right? Just like the asthma educators. And that is, to me, like that is clutch in your clinics. I really hope that comes to fruition, because I think it would prevent 99% of food allergy anxiety if we empower people with appropriate education and knowledge from the start. Parent-child communication, teaching parents, how do you communicate to your child? I get parents that ask me all the time, my child's 3, like, should I be telling them like what their food allergy is? And I said, absolutely. Like, yes, they should be, from the time you can talk to them and they have a diagnosis, you need to inform them what that means, how they can, speak up, how they can advocate for themselves. What are the signs and symptoms? And again, using age-appropriate language. And that's, again, where the allergy clinics can really help to get or give or provide educational resources to parents to how do you have those conversations? What are age appropriate? I love the quad AI stages and ages that Jenny Lebovich and some other clinicians in the mental health space had developed, and it's available on the Quad AI website, to talk about food allergies and what's a typical mindset or struggle and how do you approach that. Our goal is really to build independence for, first, the parent. If it's a young child, the parent needs to feel empowered, and then how do you pass that to the child over time? I find that once the parents feel confident, they're then afraid to let their child do anything, because they feel like, well, nobody else can do what I do. Nobody else can keep my child safe. Nobody else knows what I know. And so they get frozen in, I can't leave my kid with anyone else. I can't leave. I have to be the one. And that is a really hard feeling to sit with. So I often start with, okay, well, who else could you teach? What do they need to know? How do you teach them? So I'm going to come back to this slide for a minute. Going to, like, how do you actually teach them, right? It's focusing on self-efficacy, teaching them to build those confident skills in food allergy management. So if you're like, great, I love that you feel confident in managing your child's food allergies, what else, what does your babysitter need to know to feel confident? What does your child need to know to feel confident? And I often say, when my kids were maybe like 6 and up, I felt more confident that they could navigate their own food allergies than any other adult that was taking care of them, unless they were in the food allergy space themselves and as an adult. And truly, that gave me as a parent peace of mind, because I felt that I trained my child to be able to advocate, recognize, and it was empowering, and it is empowering to them still. So that's just something I really, really like to highlight, of that self-efficacy, the empowerment aspect for, as you're working with your patients, if you identify there's food allergy anxiety, it also then helps to identify what they're stressed about, because it gives them, okay, here's a path that I can do something with it. Going back to what I said I was going to go back to. So medication options. Sometimes if the anxiety is like too high and they are not able to apply any of the skills that they've been trying to, like coping skills, breathing, different strategies that you might have provided them over time, it's often worthwhile to explore anti-anxiety meds along with therapy. I am always a proponent for therapy. I am always a proponent for meds and therapy if needed. I'm never a proponent for just meds, because that doesn't help teach them how do you navigate life still, because there is no magic pill still, no matter what. Emergency preparedness. So that medical intervention, the confidence that the patients and the families have that they can navigate an emergency appropriately, again, eliminates almost 90% of food allergy anxiety from the start when they feel confident they can handle it. And then again, the emergency kits, medical ID, making sure they get in that habit of bringing the emergency meds, because sometimes I get patients that say, my allergist never told me I couldn't leave my EpiPens in my car. They've been in my car for 5 years. I'm like, what do you mean your allergist never told you that, right? Or and so it's making sure, along with here's an emergency action plan, but here's like what you need to know about your emergency medicine as well. That can be really helpful for parents and families and individuals. Okay, developing an emergency action plan. So again, I'm sure you all know of emergency action plans. I like to use the FAIR one. I think it's user friendly. My kid's school likes to use the AAP one. There's, I'm sure, other ones as well, but regardless of what document you use, I can't tell you how many times I get patients come to me and I go, do you have an emergency action plan, emergency care plan? And they go, yeah. And I go, do you know where it is? They said, no. I said, okay, let's look at one. So like, I'll pull a FAIR plan up, let's say, and I'll go through it and they go, oh, I really didn't know that that's when I should use an EpiPen or epinephrine. They really don't have a concept of how can you use that as an objective checklist, because they get panicked and they go, do I need my epi? Do I not need my epi? I don't know what to do. And I said, whoa, this is a checklist. You literally have a checklist in front of you, and they don't realize the value of that emergency action plan. So if you stress that value from the start, like this is your key, this is your decision-making tree, because when you don't know how to make a decision, you panic, right? So I always like to stress, if there's nothing else in terms of educational resources that they leave with, except for emergency action plan and an epinephrine injector, to really stress what the function and use and how to use that emergency action plan, and also practicing with the trainer is empowering. Going back to the practical tips for managing this food allergy anxiety, help them think outside the box. Sometimes they don't even, like when we're in that fight, flight, freeze mode, we don't even think about, oh, I can use an egg substitute in that recipe. I don't have to just throw out that recipe. There's a million different egg subs I can use. They don't explore that. So helping them say, hey, you can do XYZ, or you can do this socialization, you can do this event without having it be food centric. Giving them just some simple little things they can do to tweak the way they live can be life-changing for them. Resources, again, just some resources there's for you to explore in your own time, because there's a million different great things on each of these websites. FAIR, FACT, Quad AI, the college are great. And then I can't go without acknowledging Tamara's development of the Academy of Food Allergy Counseling, the Food Allergy Counseling Directory. So if you're not already aware of this resource, it is amazing. There are therapists, mental health clinicians that are food allergy knowledgeable and have been vetted, and they're listed by state and specialty and all of the things. So if you have a patient and you identify that they have food allergy anxiety and you don't know what to even do from there, I always say direct them to the food allergy counseling directory, and let and help them find somebody who meets their needs for the food allergy space. So on that note, I appreciate your time and attention. My business is Safe and Included. Again, I do food allergy counseling, consulting. I work in all different realms in the field. That QR code will take you to my website, but I really hope to connect with each of you in person in Quad AI if you're there, and feel free to reach out after whenever.
Thank you, Lisa.
Thank you, and thanks for inviting me.
And
Can
thank
I ask a quick question?
Yeah,
We have
yes.
time for one question. I was just wondering how, hi Lisa, by the way.
I out.
I was wondering if Neffy is changing like anxiety and what
Yeah,
your thoughts are on that.
great question. Yes, it is definitely changing anxiety. I think more and more doctors are starting to, pediatricians are starting to understand what Neffy is, because they're often that first point, right, of a prescription for epinephrine. And with that, I think it eliminates the initial, here's a needle, here's anxiety. I find that already with people that that do have access to Neffy, they're more confident and willing to do a oral food challenge that has been, pending and looming over them and recommended by the allergist for longstanding times. Often they are able to get through that in a different way because of Neffy. So yes, I definitely think it's a game changer, as well as Xolair, for sure. Good question. Thanks.
Thank you so much.